歡迎大家出席今。
Welcome to the press briefing. With us are Dr. Chang Shuk-Kwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Larry Lee, Chief Manager from the Hospital Authority. Dr. Chang will first brief us on the cases. Good afternoon. Last night, we had 4,523 new PCR positive cases, and from RAT tests, 9,545 positive cases. The total number of positive cases was 14,068 cases. The cumulative total number of cases stands at 1.049 million cases, of which some 683 cases were from PCR tests. 365,152 were from RATs. Among the 4,523 PCR positive cases, 785 were from the HA, 355 were from the CHP, 3,383 cases were found through private clinics or private laboratories. Among the 1,732 cases today, the CHP conducted genome sequencing. These cases included some that tested positive both through RAT and PCR. There were no cases carrying the L452R strain. 1,714 cases tested negative to the L452R strain. In other words, they were suspected to be Omicron cases, and they made up the majority. 18 cases were either pending or the viral load was too low. Among the cases today, 5 were imported. 3 cases were arrivals from India, Bahrain, and Singapore who arrived in Hong Kong on March the 20th. Another came from Indonesia through CX895 on March the 18th. Another arrived in Hong Kong on March the 18th from Thailand via EK384. Yesterday, there were no new cases from residential care homes for the elderly or disabled. Over the past 14 days, we received 174 cases from residential care homes, including cases from 61 RCHDs and 111 RCHEs involving 3,705 residents and 957 staff members. In terms of deaths, HA reported an extra 223 cases, including 179 deaths that occurred on March the 20th and 44 prior cases. Together with the 27 cases recorded earlier outside of the HA, the cumulative number of cases reported by the HA is 5,879 cases. 27 were reported from outside the HA. So in this wave of the pandemic, the total number of deaths who tested positive stood at 5,906, including 2,329 females and 3,577 males aged 11 months to 112 years old. The total death rate is 0.56%. For those who received 2 doses, death rate was 0.1%. Those who received 1 shot, the death rate was 0.62%. For the unvaccinated, death rate was 2.75%. So it shows that vaccination is effective in reducing mortality rate. So even getting 1 shot is better than having none. Age is among the key factors in serious cases or hospitalization, we uploaded some information on our website with regards to the fifth wave of the pandemic. For Hong Kong residents aged 60 and above, they made up 27.5% of the total. And among the infected cases, the ratio is 22.2%. For the age bracket of 60 years old and above, the hospitalization ratio is 86%. And 85.2% were admitted to ICUs. For the death rate among those aged above 80, the death rate is almost 90%. The Public Health Laboratory carried out genome sequencing on some death cases. We analyzed 281 cases so far. 24 carried the L452R, or about 8.2%. 257 did not carry the L452R strain. That is, they were suspected to be Omicron cases. That's all for my report today. Dr. Lee will now brief us on the situation at the hospital authority. Good afternoon. Right now, 11,103 cases are staying in different public hospitals: the North Lantau Hospital, Hong Kong Infection Control Center, HA Infection Disease Center, and the Asia World Expo Community Treatment Facility. Last night, there were 43 reports of patients in critical condition. 21 were unvaccinated. 69 were in serious condition. Altogether, 111 patients in critical condition are staying in ICUs. As of midnight, over the past 24 hours, 179 patients who tested positive to COVID passed away, including 102 males and 77 females. They were aged 44 to 103 years old. Among patients who passed away, 98 came from residential care homes. 115 did not have any vaccination records. 38 received 1 shot, 24 received 2 shots, and 2 received 3 shots. Among the 179 deaths, 167 were aged 65 and above. I'd like to highlight some younger patients who passed away. I would first talk about 2 cases in which their conditions might not be directly related to COVID. First of all, a 44-year-old male who was unvaccinated. He was a resident at a residential care home. He was admitted to a hospital due to low blood sugar levels. And through RAT and other tests, he tested positive to COVID. CT value was very high at more than 30. On the second day, his RAT result was positive. He was then transferred to a residential care home. And on March the 20th, he was found to be unconscious, and he passed away. And that was the afternoon of on March the 20th. Another case was a 57-year-old male who was unvaccinated, and he had mobility issues since he had cardiac diseases. And on February the 8th, he received a bypass surgery, and upon treatment, he was transferred to an ICU. And on the 9th, he was transferred to an isolation ward at the Infectious Control Center, and he was transferred to the medicine ward on 18th. And on March the 18th, he was transferred to a rehabilitation block at Lai King. His CT value continued to rise during that time, and on March the 19th, his blood pressure dropped sharply, and he was transferred to a medicine ward. His condition continued to deteriorate, and he passed away on 1:18 p.m. March the 20th. The third patient is a 56-year-old male who received 2 shots. he had a renal condition. He needed dialysis, and he was admitted to the A&E ward of Princess Margaret Hospital due to shortness of breath. The first test result was negative, and the result on March the 4th was positive. Over the course of treatment, his condition deteriorated, and he passed away on March the 30th at hour 0050. Another patient was a 50-year-old male who was unvaccinated. He had he was admitted to the Caritas Medical Center. He experienced shortness of breath, and he was found to have pneumonia. Upon an X-ray scan, he was subsequently admitted, and his PCR test result was positive. His condition continued to deteriorate, and he passed away in the afternoon on March the 20th.
The last one is a 58-year-old male, unvaccinated. He has diabetes and had a stroke before on the 3rd of March. In early hours, he turned up at the ICU at Changuilo Hospital. The rapid test at home tested positive. He had cough spells, and he had pneumonia on scanning on the 20th of March. After deterioration, he passed away. Because of time lag, we submitted 43 patients who passed away between the 15th and 19th of March. 43 people, 20 males, 23 females, ranging in age from 14 to 104. 3 patients have recovered and been discharged. And admission screening, 50 were picked up, 30 close contacts. We have 19,794 who were infected, and 13,259 have already resumed their posts. I now throw the floor open for questions. Please wait for the mic and also identify the organizations you represent. The lady in white jacket, please. Dot News. First, this policy of tiered treatment is intended to save resources, but it would involve a lot of manpower. When you triage the patients, do you have any difficulties that you encounter? And also, the community treatment facilities and community isolation facilities, can they catch up with the demand? The former chief executive of the HA, Dr. Leung Pak-yin, said that the sewage surveillance and RTD represent a wasteful use of resources. How do you react to these doubts and misgivings? Other than RTDs, are there any other measures that the government is going to be implementing? There are some reports that a lot of people who tested RAT positive failed to make the declaration, and this results in the underestimation of the COVID situation. Do you think that there are loopholes in the system? Are there any ways to plug the loopholes? Right, if I may take the question first, is COVID sewage surveillance. We have already done 183 RTD operations. 23,900 positive cases have been picked up. This is a rapid way and effective way to identify the COVID positive cases. We understand that with Omicron, there are many hidden carriers who don't really have any symptoms. They're asymptomatic, so not all of them would be going for testing. For PCR tests and RAT tests, if people do have any particular symptoms, they should go get tested as soon as possible. But definitely there are some asymptomatic carriers. And all these figures would point to the trend. We may not be able to pick up all the cases in the community 100%. You talked about the tiered system and the triage. Indeed, there are many elderly patients and there are many severe cases. The HA has different policies in this regard. There are 4 aspects. First, we will ramp up the number of hospital beds. As we said, we have tiers 1 and 2, and we also have other wards that have been converted to designated hospital wards, and also the CTF, like AWE, we are converting this in order to cater for the elderly, severe patients, and also the isolation facilities. We do have various isolation facilities, and they are catering for the senior citizens. Dr. Leung is one of our experts. Different experts do have different opinions. We are not going to be commenting on this. Lady over there, please. Cable news. The chief executive announced that on the 1st of April, the flight ban will be lifted on 9 countries, and people in these countries may be flooding back into Hong Kong, and there is likelihood of a surge in positive COVID cases. Is the HA worried about the surge in demand? Is Hong Kong's healthcare system be able to cope with the rapid upsurge? Next month, we're going to be seeing a relaxation of the social distancing measures. Do you think that there will be a rebound as a result of this relaxation? And what preparation is the HAB making for this possible upsurge? And vaccine pass, some recovered patients have failed to receive any documentation to prove their infection, that they may not be able to meet the requirements of the vaccine pass. And what will the CHP do to cater for this situation? Right, recovered patients, some of them failed to get the isolation order. We are getting on with this. We understand that the members of the public do need these documentation. Please bear with us. We will be making the arrangement. As to whether there is going to be a rebound and an upsurge in the imported cases, I think it ties in with the tiered system and the triage system. For stable patients in stable condition, they'll be isolating in the CIFs. If they do need hospital treatment, we are increasing the capacity in the hospital wards. We also have the designated COVID hospitals. And to alleviate the burden on the hospitals, we do have the community isolation facilities and treatment facilities for different people, including the elderly. And that's the way we are moving towards. Gentleman over here. Ming Pao Daily. If I may put this to the CHP, this morning it was said that the social distancing measures will be relaxed. As a result of the relaxation, how to anticipate the trend of the pandemic? Now, you mentioned the different situation, the death rate for those with 1 jab, 2 jabs, and 3 jabs. Now, for those who are unvaccinated, and for those who have 2 Sinovacs or 2 BioNTechs, what are the respective death rates? If you don't have the data now, how soon are you going to give us the data? Now, this is for the HA. Now, for the antiviral pills, have you updated the guidelines? And what are the new guidelines? How many more patients will be prescribed this new drug? Vaccine pass. The patients seeking medical attention, do they need the vaccine pass? And how will this affect people's right to get medical treatment? And also, if I may ask about the cases in the 5th wave, we can see that there are children in the ICUs between 3 and 11. What are the medical records and how are the situations for them? And there is a 14-year-old deceased case. Was the patient suffering from any underlying conditions, and how is the condition right now?
The social distancing measures would not be relaxed immediately. But if the pandemic continues to ease, as I understand, the social distancing measures will be gradually relaxed. Of course, that could lead to a rebound in the pandemic. It really depends on the situation at that time and the caseload then. Even if measures are to be relaxed, the wearing of masks would still be required, so the measures will be relaxed in a gradual manner. I would not report breakdown by age brackets since that would be too much to report. Basically, even those who received one shot would see a much lower death rate, and more so for those who received 2 shots. So the majority of deaths were from people who did not even or who did not receive any shots. Dr. Lee, in terms of the oral antivirals, adjustments have been made based on changes in the pandemic. So we would make adjustments based on the age of patients and their vaccination status, but I have no figures to report at this stage. In terms of the vaccine pass, the HA has always encouraged vaccination. At times, in light of the situation or conditions of patients, we would make decisions in order to save lives. For ICUs, I have no additional information to report. For the 14-year-old male, it was one of the backlogged cases. He fell from height and he was taken to the A&E ward of Queen Elizabeth Hospital, and he was certified dead. And subsequently, a test was conducted and the result was found to be negative, and he passed away at about midnight on March the 10th. Next question, please. The gentleman in the middle. Good afternoon, I'm from Phoenix TV. First of all, a question for CHP. In April, the flight embargo would be lifted and social distancing measures will be relaxed gradually and class would be gradually resumed. Hong Kong still sees more than 10,000 cases per day. Do you expect a lot more imported cases by then? And would guidelines be in place to avoid this rebound? And now I have a question for the HA. The number of cases in Hong Kong have come down gradually these days. In terms of the death rate, have you identified an obvious downward trend and an upward trend in terms of the discharge rate? Adjustments to strategies of Hong Kong residents arriving in Hong Kong would dovetail with our overall anti-epidemic measures. The inbound visitors would have to be quarantined or isolated at specific facilities. Indeed, we have identified a downward trend in the caseload. We hope that the oral antivirals can help more patients, especially the elderly. We have no figures on the relevant death rates. The number of patients discharged has remained at a stable level. In the past, the number of admissions would exceed the number of discharged patients, but we are almost at a break-even. Next question, please. Good afternoon. This is Hong Kong 01. First, a question on the implementation of the vaccine pass at public hospitals and clinics. When would the measure be implemented? Quite a lot of patients are unvaccinated, and would the implementation of this arrangement affect them substantially? And for patients who are yet to be vaccinated, how can they deal with the situation? This morning, there was an announcement that the flight suspension or flight ban would be lifted. arrivals who are quarantined for 7 days could leave the facility. But in the context of Omicron, do you find this a suitable arrangement? Would this lead to further outbreaks in the community? According to the number of deaths announced by the HA in recent days, many were unvaccinated and had chronic diseases. Does it mean that the chronically ill are not fit for vaccination? Or to put it another way, should the chronically ill receive vaccines? I would take the question on imported cases. The adjustment to the arrangement for inbound travelers aligns with that for locals. They would have to be quarantined for 7 days. The inbound visitors would have to stay in a hotel and do an RAT every day, and on day 5 they must complete a PCR test. The requirement is more stringent than infected persons in Hong Kong who have to produce negative results on day 6 and day 7. In terms of the vaccine pass, like I said, we have always encouraged vaccination, and the HA's priority is always on the well-being of patients. And in terms of vaccination, data show that vaccination would certainly lower the death rate. That is why we recommend vaccination. For patients who have concerns about their chronic conditions, I'm sure doctors, including the doctors at the HA, are happy to answer the questions they may have. Next question, I'm from Now TV. First, a question about residential care homes. You said today there weren't any new cases at residential homes. Does it mean that the spread at residential care homes has come under control? You shared some cases of death, and you said the first 2 deaths were more related to their underlying diseases. Can you shed some light on your criteria? Is it based on their CT value? And in terms of the vaccine pass, you said the priority is to save lives. So for those who have made bookings or as for the connection of cases with their COVID-19 diagnosis, we would try to share more information with you, but a host of factors would always come into play. The HA has a dedicated team to analyze such cases. And in terms of vaccination or the vaccine pass, our priority is always to save lives. We would announce any new decisions or strategies in due course.
TVB, you mentioned that there are no reports from the elderly or disabled home. Is it the case people have been vaccinated or the situation has improved? The number of people making their way to the mainland of Macau, other than taking the PCR test, they need to conduct another PCR test before they're allowed in. Now, what is rapid PCR test? How is it different from the usual PCR test that they undergo? Is it going to be undertaken by Hong Kong side or what? Now, for PCR test, do you have any specific threshold? What CT level would be regarded as positive or negative? Well, as far as I know, this is to guard against Hong Kong cases being exported and also to tie in with the anti-epidemic work in the mainland. Now, the PCR is the usual PCR, albeit it is faster and for free. Next, please. English question, please.
你另外一個問題係講
Oh, your other question is about the numbers of the elderly homes. Overall, the COVID positive cases have stabilized. Now, most of the elderly homes have been affected, and during the previous outbreaks, those who have already been infected have already been infected. And vaccine is another factor, of course. We have to observe a couple more days. PCR is on the basis of the lab standard. Next, please.
CMP. Also about the care homes, there's no new cases reported from the care homes. Does it indicate that there is a containment of the outbreak at care homes, or is it just because most of the residents got infected or vaccinated already? And secondly, can Secretary clarify the death figure for today, because it seems like what Dr. John said doesn't match HA's figure. And also about the vaccine pass, I know that HA said that more details will be announced soon, but can you confirm that it will be made compulsory that for only vaccinated citizens can go to public hospitals? And if so, will there be any exemptions for those unvaccinated patients? And lastly, about the flight ban. The government will lift the flight ban on 9 countries starting on April, but will there be any changes on the operation of the current flight suspension mechanism if there are important cases discovered? Thank you.
I think we do not record any, have not recorded any new institution reporting outbreaks or cases yesterday. So this is a good sign. But the reason may be that the overall situation has been stabilized in the past few days. And also most of the residents in the care homes have been exposed to the virus. So many of the cases have been already infected, and some of the others unexposed may have been vaccinated. So we still have to observe for a longer period of time. For the death numbers, we recorded 223 fatal cases reported by HA in the past 24 hours, including 179 deaths in the past 1 day and 44 bad day cases.
Okay, sorry.
Maybe you have we have included at the last minute we have included one 8-year-old girl who had been reported previously in under HA, and that girl has a rapid test antigen positive. So we have retrieved the clinical record and added that case into the overall number. And for the flight ban, I understand more details will be announced later. So maybe you will refer to that announcement.
Okay. Regarding the vaccination pass, we also don't have any details. But I think our missions will be to serve the patients, and we always allow flexibility to provide clinical service. I would like to rest reassured that this is our utmost importance to provide care, especially the emergency care, to any patients.
Last question, please. AM 730, about an 8-year-old girl, death case is going to be counted in today's figure or tomorrow's figure. Now, the HA said that 1,732 cases have been analyzed. And does it mean that each day you would randomly check 1,000 cases on the self-declaration RAT platform? And also the antiviral pills, what is the utilization like? And for the care homes, the increase has slowed down, but we have seen quite a lot of people who got infected. In the fifth wave, what is the total number of people who got infected? And for some of the homes, they continue to have the outbreak. Is the outbreak continuing, or is the outbreak really short-lived for these homes? I mentioned the genome sequencing. It has got nothing to do with the random checking. Some had the RAT test that also went to the community testing center for the PCR test. When they declared the RAT test result, we would immediately issue the isolation order. So we have really attributed the number to the tally, so we will not be repeating this in the PCR test. Now, if we have the PCR test result, we can analyze the genome situation on that basis as well. So the genome sequencing numbers may be higher than the numbers of COVID positive cases from the lab, because they make the declaration in the RAT platform. We don't really want to repeat that. As to the random checking, I am not at liberty to announce the figures. For the care homes, like you said, we don't have new numbers today nor yesterday. We do have the old numbers, but the increase is not as fast as in the past. Altogether, we have 282 RCHDs, 776 RCHEs. The number of people, 8,660 RCHD residents, 33,758 residents from the RCHEs, and 47% for the RCHDs, and 45% for the RCHEs. And for staff, 3,170 RCHD staff members, or 70%, and RCHEs, 8,430, or 28%. You mentioned the 8-year-old girl with thyroid disorders. On the 3rd of March, I've already included in the announcement in the mortality figure. Now, for the antiviral pills, as of the 16th, MSD, molnupiravir, more than 6,000 have been prescribed. Of Pfizer, Paxlovid, we have prescribed that to more than 180 patients. The number is climbing as we speak. Speaker not speaking through, 44. Speaker not speaking through. On March 7th, after the HA announcement, we haven't received the positive report. We checked in the system. We found that there was an RAT positive test, so we included the number. Speaker not speaking through. I'm not at liberty to disclose the figure. That's it for today's press conference. Thank you all very much.